Hi, good evening, and welcome to my Saturday night live this Saturday evening. And we're going to be joined today by a friend of mine and a colleague from across the pond, so to speak. And we're talking about Dr. Kavita Mariwalla, who is a celebrated dermatologist all the way from New Jersey, New York, and in the US. Kavita, Dr. Kavita Mariwalla and myself have had the pleasure to lecture with each other in December of last year, actually, at one of the conferences in the US, and I've really loved her lecture. And she's very active in the academic circles. I've also seen a lot of publications and read a lot of publications from her over time. So what I'm trying to do is I'm trying to get the invitation going. We're there, and she should be joining us shortly. And Dr. Kavita Mariwalla is very famous in the US for her evidence-based
Hello.
practice. Hi, how
How
are
are you?
you?
I'm going to see. Nope, I can't do it. I was going to try to see if I can actually put this. Oh, wait, hold on. I might be able to make this a little easier for everybody. I know. It's
We're
like
all
trying to figure out how to make your phone stand up is like half the battle, right?
It
Right.
is, isn't it? And we're all still getting used to getting it. And it seems like the kids just innately have it.
I know. It's amazing. My son's like, oh, I can do that. And he like presses all these buttons. And I'm like, how did that even happen just now?
Exactly. How are the boys?
Oh, they're good. You know, being quarantined with three boys under the age of 8 is definitely a special situation. How's the practice? Are you guys open? What's going on?
Yeah, for us, we've been open like on and off, on and off. Like we're essential services, at least because we're medical
Yeah.
practitioners. So we can open, but the sentiment among the people, they're quite scared. People are really cautious about having to step out
Yeah.
unless it's absolutely critical.
Right.
And so we've definitely seen that it's still very dull in the practice, but we're definitely seeing a lot of our older patients and our long-term patients coming in because they know about us and stuff. But the new consults, I say, have taken a hit because people are like, we want to come in, but we're going to wait for COVID to get over, and nobody knows when this is going to
On
get over.
Nobody knows what's happening. You know, in the US, as you know, our numbers are still spiking, which I don't think any of us would have predicted that to be the case. You know, we kind of thought, okay, there'll be a wave, a dip, and then we'll wave again. And it's just like that wave has continued. So it's a challenge all around for sure. Which is why when you asked me to talk about this topic, I was like, could not be more timely. Everyone's hair is falling right now.
Exactly. I mean, the amount of queries we're getting in online consults has become the norm now for us.
Yeah.
And it's everybody's like, I'm losing hair, I'm losing hair. I'm like, are you actually losing hair or do you have time to count the hair you're losing? But people are like, doctor, it's just coming off. I'm like, okay.
Yeah, so it's interesting because I found, you know, we really had in New York State where I practice, we had our peak in like that March, April time zone.
We were the first people to peak, like after Italy and stuff. It was just like bam, whoosh right there.
Yeah. And so when people are talking to me about hair loss, I'm like, oh, listen, I get it because I go like this and I'm like, oh, look, you can see strands now. The
Mm,
clumps falling out. And I do think it's really important to, like you said, kind of get a sense of what's normal versus
yes,
notice because we're at home all the time. So
yes.
whereas like on an everyday basis, you'll be shedding hair all day long. You're not checking, you know, your office space, the bus, the train, you know, where hair is shedding. But now you're home. So you're noticing every strand that's everywhere and it's making people panic.
Yes, very true. And because I'm just thinking that a lot of times it might just be regular hair shedding because we do anyway shed about 50 strands a day, sometimes 100 strands. But to everybody who's now just washing it around and closed spaces, it just seems that there's a lot of hair around.
Yeah, and I think seasonally too, right? People, I do think even though there's a growth cycle and a hair
Mm,
falling cycle and then, you know, a quiet cycle, you know, when the seasons change, it definitely tends to pick up a little bit in the seasonal shedding. So you add that to
hmm
daily normal shedding and
hmm
panic for sure.
Agreed. So, is it the same in the US too, or is it just like we're experiencing it here?
So for me, I'm actually seeing a ton of patients with hair loss. So number one, it's people who have experienced a lot of stress during COVID.
Mm, mm,
Um, that's understandable, right? We're home, we're homeschooling. People are worried about their businesses, people are worried about their jobs. And we know that typically after large stressors, and they can be good or bad, right? Like very
mm-hmm.
happy things like the birth of your child.
Yeah.
4 months later, you can have intense hair shedding called telogen.
Mm-hmm.
Okay, but that doesn't necessarily have to be a medical thing that happens to you. I mean, it could
Mm-hmm.
just be emotional and sort of psychic stress that could
Mm-hmm.
induce the same thing. And it usually has that lag, like about 12 to 14 weeks. So I tell people, look, this started really becoming a problem in the beginning of March in the United States. Now we're in July. So this month, if you start noticing, or last month, you start noticing a ton of hair falling out, absolutely that can be a contributing factor. And then also, I have patients who, again, practicing in New York, we had a lot of people who had COVID. And
Mm,
things that we are 100% noticing is that as people recover, they have long-term issues in that recovery phase. So it can be cardiac. My husband's a cardiologist. They're seeing
mm,
a lot of like conduction abnormalities, vascular phenomenon. And on the derm space, we saw a lot of rashes from exposure.
yes.
And now we're seeing all the people who have just tremendous telogen effluvium, like that stress-induced, sickness-induced hair loss.
Mm,
I tell people, when your hair falls, look at the strand itself. Because sometimes they notice that little like white, almost like hard
like a
clump
head.
at the end. Yeah. And that truly is like that club hair that we talk about in dermatology.
Mm,
That's almost like diagnostic of telogen effluvium. And I think that is when you start saying, okay, there's a reason I'm losing it, but that doesn't necessarily mean emotionally I can deal with it. And you still feel like, does this mean I'm going to be completely bald?
newborn.
And how can I make it grow back in faster?
Mm-hmm. True. So, and but we also tell them that with telogen effluvium, you don't have to worry as much because a lot of the hair that you lost will actually eventually come back if you take care of it.
Yeah, so I actually, having currently going through this myself, I feel
Mm-hmm.
like I definitely have a lot of sympathy for my patients because I feel like, it is very stressful. You're like, wait a second, I have this like big, especially for Indian hair, like this big, thick, braid or ponytail. You can barely get your hair tie around it 3 times. And now all of a sudden I do this and I'm like, oh my gosh, this is terrible. So there are a couple of things that are my go-to. If you have
Mm-hmm.
two, there's lots of reasons for hair loss, but
Mm-hmm.
for stress induced, um, especially for people with pigmented skin, so like our population, we tend to be really low on vitamin D. Um,
Yes.
and I think that's an often overlooked phenomenon. So you can have sufficient levels, right? Like in
Mm-hmm.
the US, we consider under 40 to be deficient and 40 to 90 or 40 to 100 to be sufficient. But I
Yes.
think in Indians, you have to actually be at the higher end of that sufficient
Yes.
number for your hair
Yes.
to really withstand the falling. Um, and so I always like to tell people, the next question my patients have is like, okay, well, how much should I take?
Right.
Right? And it's like,
Exactly.
yeah, I have to remind them that more is not more with vitamin D because it is a fat soluble vitamin. So you don't want
Mm-hmm.
to just keep taking, 10 pills a day. So normally, you should be taking 600 units of vitamin D daily, and you can
Mm-hmm.
get it in your food. The mistake people make is thinking they need sunshine to get it, and that's actually probably the least efficient way to get vitamin D.
It's
Uh,
true.
600 units a day is maintenance. So now let's
Mm.
efficient. So you have to take at least over 600 units a day in some form or another. And if you're trying to supplement, the time that you want to supplement is about 8 to 12 weeks.
Mm.
You want to keep supplementing for the whole year. I don't know if do you recommend the same thing?
We do, and it's amazing like how many people are deficient. Like I would say about 9 out of 10 that we test, and they're like, "Oh, doctor, I'm always in the sun. I don't even use sunscreen, so I'm sure I have great vitamin D." And you're like, it has nothing to do with that. And I tell them that genetically, for whatever reason, it has to do with our enzymes. Indian origin people tend to be deficient in vitamin D. And then if you connect it, they'll give you this history of feeling a little dull, a little bit of lethargy, and it all links down to that. And so I always put them on the sachets. I don't like giving them tablets as much, so I put them on a sachet and I say just put it in water
Oh,
and
tell me.
drink it.
I don't think we have that in the States. Tell me.
So we get like a 60,000 IU sachet. So we just put it in a glass of water once a week, and then I tell them just drink it through, and then do it for about 8 weeks. And after that, I tell them once a month, keep doing it, but just once a month so that you maintain your dose. And I always tell them that once in 6 months, get your vitamin D tested.
Yeah, we do the same. So I'm super tan right now for my baseline color and my vitamin D level, and it was like horrendous. My level was 13. My husband's like,
No.
yeah, he was like, do you have rickets? And I was like, I don't know. This is terrible. I had no idea I would even be that low. I feel like I'm not like some skinny, scraggly person. I eat a robust diet. And it was like shocking to me. And so I agree with you. I cannot stress enough how important it is to have that D level up. So I like to have my patients supplement until when we check them, they're in the 80 to 90 range. Even though 50 is sufficient and 60 is sufficient, I feel like that 80 to 90 is where you get the sweet spot for getting your hair to grow in faster. And so, yeah, same thing, 60,000 IUs once a week for every 8 weeks. In the US, they have the pills that come like at Costco and like these big boxes.
Yes.
So I tell patients, if you're going to do that, take 2,000 international units 3 times a week. So a total of 6,000 a week. And then you take that for a total of 10 to 12 weeks. That usually gets you where you need to be. But I also recheck. And I also do baseline labs for any person into my office for hair loss, because as you know, there's so many reasons.
So what is let's go with the thing. So let's say somebody comes to you and says, Doc, I'm having hair loss, right? Typically, let's take 2 scenarios, a woman and a guy. And how do you go about with a woman? Let's start with women. How do we go about in women? Because, there's so many things. What goes through your mind and what's the checklist that you're ticking off?
So the first thing for my female patients is I acknowledge that I understand that that's a problem, because come to me, almost all of my female patients have said, I told my doctor I'm having hair loss, and they told me, oh, look at your hair. You have so much. What are you talking about? Like, nothing more frustrating a woman than to know your own body, know that your hair is much thinner than it used to be, and then have somebody dismiss your concern. Like, if you saw me now, right, you wouldn't say, oh, Cov, you have a lot of hair loss, except that if I showed you my sink and the width of my ponytail, you'd be shocked today versus 6 months ago. So number one is acknowledging that, okay, let's talk about what could be going on in your life. Take it carefully. So common things being common. Have you had any sudden weight loss? Have you had a child? Are you going through any, like a divorce? Sometimes people, even like if you're Indian, planning your wedding is a very stressful.
Yeah, totally.
Like, that are stressful, just big life.
Bridezilla weddings.
Yeah. And then I talk to them about any illnesses. So I try to think about, okay, if they have telogen effluvium, let's talk about that. Then I ask them about their diet. Are they balanced meals? And then I ask them about other symptoms. Like, do they feel like they're more fatigued lately? I want to try to screen for things like anemia. Are they having I want to try to screen for things that might induce like an autoimmune disorder, because again, in a lot of Indians, markers for autoimmune disease flip in and out. The sun that we get or don't get depending on the season. So there's the ANA, which is a marker for autoimmune disease, but a lot of times in South Asians, that'll turn positive, but the person won't really have lupus. And then, but what I find is that when the marker's positive, even though they don't have lupus, they get some clinical symptoms of autoimmunity, and that includes hair loss. Do you know that?
Yes, I do. It's so funny because a lot of times people ask me, why are you doing this test? What has that got to do with hair fall? I mean, everybody thinks it's ferritin and hemoglobin, vitamin B12 and D and stuff. And I'm like, no, I want to do the entire thyroid panel. I want to do, like, a lot of times your thyroid could be normal, but your antibodies could be off. And then I want to do the whole polycystic ovarian hormone range. And then I want to do the ANA.
Yeah, I think that's two really good points because in our community, thyroid problems are prevalent. And
Mm-hmm.
also keeping in mind that people with thyroid disease, it runs on the same allele as diabetes and also alopecia. And a lot of
Yes,
people realize that genetically, that's our lot to bear. So,
it
so
is.
I,
Yeah,
and I also think a lot of people don't realize some of their medications can induce hair fall.
that's
Like
true.
another.
I think that's important. You should touch upon that.
Yeah, so, especially in our community, and one of the reasons I'm so happy to do this with you today is because I do think that hair loss is something that has to be tailored for the person and does have to be looked at in sort of like a genetic way for that community. So, for example, Indians or South Asians in general, we're a population that we get diabetes and we get heart disease like
Yes.
crazy, right? So practically like you would think that statins are in the water. They should be, right?
Yeah.
All any water supply going to South Asian home should have statin in the supply.
You should like statin infused water bottles.
Exactly. Found our new our new business venture. But statins, remember, they dry out your skin too, right? Because they decrease your cholesterol, not just in your blood, but throughout your entire body. And one of the key components of your skin is cholesterol. That's one of the fat
Yes.
of your skin.
It's your lipid barrier membrane. Yeah.
Exactly. And so now your skin all over, including your scalp, gets really dry, your hair dries out. All of those things can lead to hair fall in a mechanical way, but what we
Mm-hmm.
see is decreased hair nonetheless. And also some blood pressure medications induce hair fall. So like
True.
the
Mm-hmm.
beta blockers will do that also. So people will suddenly be, and this is especially true in women, I find, men
Mm-hmm.
tolerate things like metoprolol or,
Mm-hmm.
better, but in women, they start losing their hair. And I don't know why that is, but I have found
That
this.
and even psychiatric medicines, if they're on for depression and bipolar disorders, I find that they lose a lot of hair and then get acne at that time.
Yeah, totally. I agree 100%. So we kind of three-phase approach in our office. So we take a careful history and then we send them for lab work. So before anything
Mm.
else, I say, okay, you have to go get this lab panel and let's make sure there's nothing internal going on. The other thing is I ask them, a lot about their dietary intake because we tend to have lots of different types of food, but some people have
Mm.
problems and they just assume it's because of the spices in their food. But it could be that they're not actually absorbing nutrients
Yeah.
well.
Yeah.
And then if the labs come back normal, then our next step, so if they come back abnormal, we talk about anemia, we talk about supplementation, et cetera, et cetera. If they come back normal, our next step is we actually take a biopsy of the skin of the scalp.
Really?
Yeah, because that can help us really figure out like what exactly is the cause. For us, I mean, as somebody who's actually had alopecia areata due to stress and is gets telogen effluvium, I guess because of stress, I find that getting an answer is almost like half the part of the cure.
Mm-hmm.
You know what I mean? Because people just sit there, by the time they come to you, everyone's denied that they have hair loss, or they feel like, oh my gosh, everybody in my family. Oh, that's the other thing we forgot to talk about, family history. All the women
Yes.
are bald.
Yeah.
It's, um, we take a small biopsy, and the key thing is a lot of people, there's like two schools of thought about that, is that you have to take two biopsies or you have to take
Mm-hmm.
one. So we take one.
Mm-hmm.
People who say take two, they say take one up here and take one in the back,
Right. Right.
two small ones.
Right.
So in my practice, we take one slightly larger one. So instead of two 2 millimeter biopsies like here and
Mm-hmm.
here, we take one 4 millimeter biopsy and tell them to split it in half and check it.
Right.
Horizontal layers for any doctors who are on. Then at least we have an answer as to what.
Mm-hmm.
I also then at that point, I'm a big fan of supplements and
Mm.
also growth factors. And if all else fails, I then go to procedure-based things like PRP.
Mm-hmm. So what's your go-to supplementation? Like what kind of supplements do you prescribe?
So there are kind of like two categories of thought on that. One is what is the source of your supplementation, and do you need more kind of like homeopathic remedies?
Mm.
So we do know that there are homeopathic remedies like saw palmetto
Yes.
that will definitely um, help you grow your hair. It can be a little bit disruptive if you are a man with prostate problems. Hi.
Yes.
If you're a man with prostate problems, it can cross a little bit, so it can mess up your PSA, so be careful. The one vitamin I tell people not to take, because I do think it's a road to nowhere, is biotin. And
Really?
yeah,
I want you to elaborate on it because everybody's like, well, I'm taking biotin, I'm taking 1,000, I'm taking 5,000, I'm taking 10,000. I'm like, for what? So I want to understand this.
okay,
Why no biotin?
it's a road to nowhere. Yeah, see, so biotin actually, I think, does more harm than good. So biotin in head-to-head studies has not been shown to truly improve hair growth, right? It doesn't improve caliber, it doesn't improve density, and it doesn't improve rate. Most people are not biotin deficient. While it's true that it's excreted in your urine, so you can't really overdose on it, fine. So like if you take it, there's nothing wrong with taking it, but it's not going to help you. And more importantly, if you're taking it before you get lab work checked, you're going to mess up your lab work because the ingestion of biotin interferes with the lab assay for thyroid and for thyroid tests. So it doesn't make your thyroid go bad, but the test will come out, wrong because it interferes with the test. The other thing it interferes with, which is really important in South Asian populations, is it interferes with your troponins. So God forbid, biotin, you get chest pain and you go in to get evaluated, they could think you're having a heart attack, and meanwhile it's your 50,000 biotin that you're taking every day for your hair loss. Do your blood pressure medications. It's
true.
It's a very bad situation. So I actually think biotin doesn't really help you at all. I do think.
Wow, that is an awesome point because that's something I learned you today too about biotin and the change in the thyroid assay. Wow, thanks, Kavita.
No problem. So I'm a big, don't take biotin. It will not help you. Saw palmetto helps you. I do think zinc helps you. I do think magnesium helps you. You know what else I think helps a ton is turmeric.
Yes.
Again,
curcuminite and turmeric.
Yeah, totally anti-inflammatory, great pathway to go down in terms of, trying to stop hair loss. And then, of course, we talked about vitamin D. For people who are in iron, you want to take iron supplementation. The one thing I would caution against is that if you're taking iron supplementation, take slow Fe. It's called slow Fe. Otherwise, you'll get really upset stomach.
Yes.
And then, but there are supplements on the marketplace that kind of combine all these things together.
Yes.
So, are there any brands in India that you particularly like?
So, my clinics, we have a research center, so we make our own supplements for this. So we have two. We have one called the Cosmo Hair Capsules. So that's just all the supplements and nutrients needed for hair. And then we have Hair Gen, which has saw palmetto. It has protein in it. And then it has elements, it has zinc and magnesium and all of this. And then it also has a anagain, which is like a pea extract.
Okay, yeah.
Yeah, so it has the green pea extract in it, anagain. So
that's actually awesome because I think a lot of people don't realize pea flour and pea extract are very good at helping strengthen sort of the keratin kind of concept.
Yes,
it does
exactly.
Oh, I love that because now you're getting hair growth, hair strength, and hair density in that supplement.
Yeah, so we do a combination of the two.
You might have to send me some of those.
Done. I will send you soon enough.
But I
actually
Hair Jet because I do think that is the winning combination. Because if you just take magnesium straight, I'm not going to help you. You have to just trace elements of it exactly like you said. In the States, we have a few brands. One is called Viviscal. One's Fall. There's one by a company called ISDIN, which I happen to like a lot. It's interesting because some companies on the mass market will market for men. Some will market for women for the supplements. And that's true for things like Rogaine. So one of the other fallacies, I don't know if a lot of people over there use minoxidil.
True.
So that's another pet peeve of mine because I think once you go on minoxidil, you're on it. There's
Yeah.
coming off.
So that's what I do to our patients too. I'm like, listen, I'm going to try and get the best results possible without minoxidil. And because I could just say, yeah, I'll grow your hair in a few months, give you minoxidil, you'll be happy. But the day you stop it, it's all falling out. So we're going to be back to zero and probably worse. So I try and have them off minoxidil. And so even if they've been on it for a long term, I'll wean them off it and they'll say 6 months clean of minoxidil before we start peptide serums, growth factor serums, etc. But yeah, I'm like very anti minoxidil unless nothing else works.
Yeah, and the thing is, minoxidil, I do think makes your hair a little wiry.
Yes,
Yeah.
doesn't it? And it gives headache to some people. Some people
Yeah.
get headaches.
And also, it can make you have hair growth like down to here if you're not very careful, you know what I mean, about how you apply it or you put it on and then you go to sleep. Over time, you'll get all this hair here. So you're kind of like replacing one thing for the other. I also think that with minoxidil, don't worry about female versus male solution. Just get the strongest solution you can get and move on if you're going to go that route. But I agree with you. I don't do it. And then the same thing, interestingly, for men, you know, a lot of men want to be prescribed finasteride or Propecia.
Yeah.
So what are your thoughts on that?
So if I find that there's a history with the father and then grandfather and uncles and everything, and I know that they're going down and it's at a very young age, like if they're in their early 20s and they've already got a significant amount of loss and they're not looking at going down a hair transplant route right now, then I will say, okay, let's try the finasteride 1 milligram tablet and see how long we can delay and postpone it. But I'm like, eventually it's going to come off. So we have to get that hair transplant there. That's
Yeah.
my take. What about yours?
So, you know, it's interesting. I think that finasteride is something that works, but there's a lot of data now about this post-finasteride syndrome, especially
Yes.
if you talk to like Dr. Leopoldis or like Jerry Shapiro here in New York. In Brazil, it's a thing. And it was interesting because I was talking to him and I was like, wait, why is it so prevalent in Brazil? And then he just turned around and said to me, he's like, have you ever seen a Brazilian man who's bald? And I was like, no, I haven't actually. Makes sense. And he said, you know, there's a lot of sort of emphasis placed on hair and looks. And so a lot of people use it. And what they're finding is that when you start it younger, you have a higher risk of developing this post-finasteride syndrome, which is categorized by, you know, not just loss of libido, but depressed mood, feeling like you're just more lethargic, you can be a little bit more cranky. And, you know, my husband, who is a cardiologist, he started to lose his hair. And I always told him for years and years, just like, you're being crazy. It's not falling out. I don't know what you're doing. But God forbid he listened to his dermatologist wife. I like see him all the time taking photos like this of his hair. I'm always like, fine. But anyway, what was interesting is that he decided he wanted to try it anyway, right? Okay. And it truly did change how he is as a person. And I noticed it like within a week and I was like, I refuse to let you take this. I didn't want you to take it to begin with. And he said, you know what, you're right. So I do think this post-finasteride syndrome is really a thing that's a little bit underreported globally, but in countries where people use it a lot, they are noticing that. So I try to really hold off on people taking it, but I do think if they're going to end up with a hair transplant, you have to do something to maintain that because their general predisposition is to not get it. And I also tell people that they shouldn't even consider hair transplant before the age of 25.
Yeah.
Because, you know, your hair loss isn't even stable then. So getting it, you'll just get it here and then you'll keep losing behind it and that will look terrible.
Exactly. I agree with you totally about it. And then we have this long discussion about the implications of taking finasteride. And sometimes my fellow patients are like, And I'm like, well, we got to discuss this no matter how uncomfortable it is. And I talk them through it. And I'm like, I give them like website addresses and like, you know, white papers that have been published. I'm like, you can have a read through, understand it. Let's discuss it. And you still want to take it, we'll do it then with supervision.
I think that some people also prescribe it to women. And, you know, I think that's kind of like a last resort thing. for women who have female pattern hair loss, which really is a thing, I try to put them on medical management like spironolactone to decrease their overall testosterone content in their blood before I put them on anything like a Propecia, because I'm really, you know, like I said, I just think there's long-term implications for it. But then I also do love PRP, and I was stalking your gram earlier, and on it, I do it a lot too. I think it really does work.
I agree with you. I think it's very efficacious. It just depends on the quality of the PRP. It's really the technique and extraction of the PRP. And if you do it right, the results are really amazing. We just don't need to do it every week or anything. I really space it out. I think once a month is a good duration for them to get that PRP going. But what we do here is based on the kind of hair loss they have, we'll even combine it sometimes with like a derma roller, like a microneedling treatment, and then we'll put like the plant stem cells, which is like the plant growth factors literally, and we put that into the scalp after the microneedling, so that we do it like every fortnight, so that once there's a stimulation with the plant growth factors and the nutrients delivered directly to the hair, and then once a month is the PRP.
How do you get those plant-based nutrients?
So the thing is, for us, we can use CE approved. So there's a lot of European formulas like Meso Aesthetics, etc., which have these plant-based extract serums which are approved. So that's the ones we use.
That's awesome. That's really awesome. Yeah, I do the same kind of schedule, again, because the FDA, we don't have those, half the things that you guys have options for. But I do think therapy is really helpful. I do the same. I do it every 4 weeks. I tell patients that the first night they're not allowed to wash their hair. They can shampoo the next day. They cannot exercise 24 hours. They sometimes hear like pops and crackles, you know what I mean? Like in their skin. But I tell them not to worry. They can sometimes get a headache. But I tell them again, don't worry about it. And all the like little bumps that you get when you're injecting the PRP, those will go away. And so we do every 4 weeks, and then for 4 times, and then we have them check again in 6 months. Some people like to supplement it with laser helmets or laser light therapy, which I think is interesting. I think if you're going to go that route, you have to do something with red light. None of the other light sources do anything. So what about microneedling in a product like hair stim? So Corey, that's a great question, because a lot of people try to microneedle in things like minoxidil and try to microneedle things in like other therapeutics. So I went to an interesting talk at the AAD. And so Dr. Leopoldo dos Santos, who's like a really great hair person in Brazil, who I was talking about before, he uses a tattoo machine, and he uses a tattoo machine to tattoo in actually liquid minoxidil that he then combines with other hair stimulatory products. The problem is that if your solution is not sterile, you can potentially end up giving somebody granulomas in their entire scalp, and then you just knock out all their hair follicles. But I do think there's something really interesting about that, but you have to get to an adequate depth to actually make any difference. What do you think?
Yeah. It has to go at least like 1.5 millimeters depth.
Yeah.
I mean, it's not going to work at 0.5 millimeters and stuff like that. So it needs to be deep.
Doing that will not do it.
No, that kind of microneedling is not going to get anything done.
Yeah.
There was a question here about home microneedling and if it's safe for people to just use a microneedling device or a derma roller at home. What would you say?
No. You would hope, because we've both seen the complications that happen. Because I tell people, look, when you're using needles across your face, are you throwing that device away afterwards and getting a brand new one the next day? You're not. You're using the same one. And we know that for needles to be fine enough to not cause a lot of pain when you're doing it, they also dull after 4 or 5 injections. That's true when we're that's true when we're injecting fillers. So why would we think that those needles will stay as sharp on day 1 of using that home micro, derma roller as they would on day 100 of using it? They won't. And all you need is one dull needle to drag across your face, and that's the stuff that we see. So I'm definitely anti-home derma roller situation. And on the scalp, you know, again, you got to make sure that everything is in a clean situation because you really can induce a lot of problems. The last thing you need is like a big bacterial folliculitis or, you know, like every time I go to India, my mom's like obsessed, and my dad's obsessed, like, oh, let's go get nail polish. And I was like, no, you know, and they're like, come on. And I'm like, oh my God, you know, because again, like you have to figure out what are you putting on your scalp? You have a ton of follicles. You don't need like a big bacterial outbreak on your
Oh, that is so popular though, the tail polish in
don't
India.
get me wrong,
Everybody does it.
but
But yeah, I agree with you. I think using anything with needles, anything that can penetrate your skin surface or your scalp barrier is unsafe because you're not sterilizing it after use. And second thing, penetration. It's not safe to do anything like that. It's not like you're going to go take a needle and prick yourself. So why do you think it's okay to prick your scalp with 36 needles at the same time? Because they want to save money and not go into get treatments at a doctor. Sometimes, I mean, people tell me that, doctor, we don't want to get so many treatments, so maybe we can do it at home. I'm like, why don't you put a stent for yourself at home
yeah,
too?
I know. No, Priyanka, it's totally put oil on your scalp. I'm just saying, like in general, you want to be careful about, you know, you're not going to put dirty oil on your scalp. You know, you want to make sure that you're aware of what's going in there. So, but I do think when you come to the doctor's office, and we do microneedling, you know, we do it with disposable tips, so everything is, you know, safe and okay. No, Charming Desert Rose oiling is okay. I'm just saying that if you use dirty oil or you don't know where you're going or somebody with not clean hands is massaging it into your scalp, you can get a folliculitis. But anyway, I don't want to discourage anybody from thalmolish. I'd be doing you all a disservice. Go for it. But you know, like go to your office or my office, we use like sterile, disposable tips. But I do think the concept of microneedling actives into the scalp is very interesting, and I do think it supplements what PRP does for sure. And I agree, it should be a 2 to 3 millimeter depth every time you do
Yeah,
it.
yeah, I think so. And I think somebody asked us back saying that minoxidil, do we lose more hair or come back to baseline when we stop minoxidil?
So, you know, if you've been using minoxidil, so the data is as follows. If you've been using minoxidil, you will have the most hair that can grow at the end of a year.
Mm-hmm.
Hair grows at the end of 1 year of using minoxidil will be the most that it gets for you. And that's true for finasteride also. So it turns out that you know, taking a pill or using minoxidil, your max result is at the end of a year. After that point, it basically stays the same. So you're preventing that 1 year of difference from going away.
Mm.
If you stop it, it will go back to, you know, all of that hair will fall out. It doesn't mean that it goes back to baseline because your baseline also changes over time. So it could end up being worse because you don't have any hair that grew, you know, you lost all the hair that grew for that time period. But it doesn't make you lose more hair. It just promotes hair to a certain point. And for finasteride, the curve actually kind of goes like this. So it
Mm.
turns out that you take it for a year, that's your maximum growth. You take it for 2 years, it doesn't always plateau. It comes down a little bit. And so again, it's one of my like reasons I'm not a huge finasteride fan is because the first year everybody's like, I love it. I'm going to stay on it for the rest of my life. And then 3 years later, they're like, I don't feel like it's doing that much for me anymore. And that's why. And then they're cranky. So like, it doesn't. Um,
Yes. What is a good oil to use? Let me take this. So it depends on the kind of scalp you have. If you have an oilier scalp, try and use like a neem-based oil. If you have a drier scalp, you can go towards cold-pressed coconut oil, or you can even use almond oil on your scalp. These are all safe and efficacious. Some people use olive oil, but only if you have a drier scalp. Don't use olive oil on an oily scalp. And another question was, if I use non-greasy oil, how long can we put it on? How many days? And should I usually wash it the same day? Well, typically you don't really need to leave oil for more than 20 to 30 minutes. Your scalp will absorb what it needs in those 20 to 30 minutes. And usually we suggest that you warm the oil and then put it on so that it expands the absorption in that area. But leaving it on overnight, etc., is just psychologically you might feel good, but it's not doing anything to the scalp.
Gonna mess up your pillowcases.
Yeah, stinky.
Yeah, so things like that in the US, I wish we had more access to. Like neem oil, I think is awesome. And I do think that that is great, not just for the strands of your hair, but the actual scalp itself.
Mm-hmm.
And maybe, you can give some point of view on that, is that when people use scalp treatments, how do you tell them to use it?
So usually I tell them that if they're having any scalp treatments, for at least 5 days after they've had a scalp treatment, not to put oil or anything on there. They can wash after 24 hours. I don't even say next day, because if they came in the evening, they want to wash the next morning. So I always tell them, please give us 24 hours before you wash. And so I tell them that I don't want you to have any kind of chemical treatments or anything in your hair for at least 5 days after the procedure, and for at least 3 days before you come in.
And do you tell people that it's okay to color their hair or things like that?
I tell them it's okay to color their hair, but I ask them to give it a week's gap, a minimum of a week gap, but not before a week. What about you?
So I make it really clear to people that, so culturally, I feel like South Asians are used to the idea of like massaging your head or massaging, like when you're we massage the babies a lot, so they're used to that concept. But a lot of people don't understand that even simple things like shampoo, there's a difference between the hair that's like down here at the bottom and, your scalp. So when
Mm-hmm.
writing for a lot of things, I explain to them these are actually scalp treatments. They're not for hair per se, because this is already done. You're not changing this other than conditioners or, color to kind of make it lay down flatter. But this is already, done. It's grown out. It is what it is. It's curly. It's gray. It is. But if you're trying to do something to stimulate more hair to grow, I explained to them you have to part your hair and really get it in the scalp itself, rub it in, and then make another section and rub it in, and do 1 drop per sort of row of scalp.
Yes.
Really rub it in, because you're trying to treat the follicles and where the hair is starting from. I'm fine with people coloring their hair. I just try to make sure that they're using products that are a little bit more gentle if I feel like actual hair is getting damaged by it. I'm also not a fan of keratin treatments. That's a big thing here in the States, of hair straightening products. Because even though they claim that they're formaldehyde free, they almost always have formaldehyde in it. It's like not possible to break those sulfide bonds that cause curls to lay flat. That a chemical. And I do think over time that actually does damage the hair kind of permanently. And people say, oh, but I only do it like once every 3 months. And what you don't realize is that's the growth cycle of hair.
Of your hair, exactly.
And so that actually is pretty frequent. The other thing I love about what you're saying about the supplements, like here in the States, we've got Viviscal, we've got Nutrafol, we've got ISDI, and we've got a couple of others. I always think it's important to know the source of your supplements. Marine source, if they're plant-based. I tend to be a bigger fan of plant-based things. Again, because like where you're getting collagen from and stuff like that, you kind of want to know the sourcing of it. But I also think active botanicals work better than other types of sources. And some people will try to say to you like, oh, well, you're more mature. You should have like a plus, version of your or
you need like double time the supplement.
Yeah. And I'm not sure that I really believe in that, because plant-based botanicals work regardless of your age. And hormone levels exert a whole different kind of thing on your hair and your body in general. And that's not necessarily something that a hair supplement's gonna replace.
I agree with you totally. Like our supplements are plant-based. They're all botanical. And we don't have. So one of the questions here is Cosmetologist hair capsules. Is 1 day enough? How many weeks to start with? Well, honestly, Ms. Chytra, it depends on your blood tests. But so I would suggest that you just get an online consult with one of our doctors, and we can talk to you through it rather than to give you a prescription for it. But typically it's 1 a day, and minimum is 3 months, because that's your hair cycle. Corey has a question for you, Kavita. He says, if I missed this, I don't know, but what are your feelings about Lantoprost or Bimatoprost for your scalp?
Yeah, so there's a lot of promising data of like kind of, is Latisse going to be in a foam, or is there a way to make that actually make hair follicles grow? And I think that it works in a certain age group. Beyond that, it won't. Just because your hair follicle, I think, the hormonal regulation at the level of the bulb, like can't get over just with, bimatoprost, but I do
Mm-hmm.
super interesting idea. And I think it happens to work incredibly well in spots of alopecia areata. It does make that hair growing faster. But if you're having like androgenetic alopecia, I don't think it works that well. But if you're having like patches of stress-induced alopecia, or like especially in the beard area, I think it's a charm.
So our next question is, I have thyroid issues, but it's controlled with medications. Why do I still have hair fall?
Oh, so it takes 2 years before your thyroid's regulated for that to not exert an issue on your hair. So a while before your hair comes back completely, and it's about 2 years.
Yeah, for us in India, a lot of times we have a lot of patients with polycystic ovaries or with thyroid issues, and they're like, oh, I'm taking herbal supplements because, in India we have Ayurveda, we have homeopathy, and we have allopathy, and then they're like, and I'm like, listen, correct your hormones and then go and maintain with like Ayurveda and homeopathy. When your levels are off, don't dilly-dally. You need to get it under control.
Also,
And
realize some homeopathic things cross with actual sort of Western medicine medications. And so your metabolism and other things that can be in disarray will actually worsen a little bit. And then there's no way to check it.
exactly. So that's something that we agree on. Okay, one of the dermatologists, Bartow's dermatology, is asking you, how do you dose your spironolactone?
So I dose it. So I'm like a very scared person. So I check potassium levels all the time.
You
Even
mean cautious person.
so yeah, I'm like belt, suspenders, and then more belt. So even though the data shows that you don't have to check potassium in people who take spironolactone,
Yeah.
there have been subsequent, reports that say, well, actually, if you're an older person and you're on any medications for your heart, or you have any blood pressure issues, you should check it. So this is what I do. I tell people the following. I'm going to start them on 25 milligrams of spironolactone. The max we'll ever give anybody is 200 milligrams a day. I tell them to avoid potassium containing foods, so bananas, avocados, and watch their fruit juice intake. And then we double it every time they come in. And I check a potassium at 6 weeks, and then once I know they're at a stable dose, we kind of stop checking it. Heather Cornwell had asked, what about if you're pregnant or nursing and you're starting hair? So during pregnancy, if you're losing your hair, that's actually should be something that's fairly alarming, because in pregnancy, your hair is in like basically the growth phase and is in the arrest phase entirely. So if you have a pregnant woman coming in complaining of a lot of hair fall, that's a bit of an alarming sign, because I actually checked this myself every time I was pregnant. I think I lost like 5 strands of hair, literally no joke. I could not get over how little I lost. And then of course, 8 weeks later, I was like, poof, it all fell out. Why effluvium happens, right? Because you're in the rest phase, and then all of a sudden it catches up with you. So all the hair you would have lost for that 9 months suddenly starts to happen. So breastfeeding women, absolutely, they should be losing their hair because that's part of the process. But I'm very cautious about supplementing soft palmetto and things like that in breastfeeding women because they cross the barrier. And so you just say, you know what, hang on. I do like topicals for that though. And that I think works really well in terms of being able to stimulate hair growing back.
I'm totally with you. I don't give supplements when they're pregnant or if they're lactating and they're having hair fall. I'm like, it's natural. Let's stop, and then I'll treat you for it, and I'll promise I'll help you grow your hair back, but finish the lactation.
Yeah, agreed.
But I had my best hair when I was pregnant too. I mean, it was just amazing. Yeah. Okay, so another last question for tonight, otherwise we'll get cut off. So how do you analyze and treat androgenetic alopecia, and what are your options?
So, I do that biopsy of the scalp sperm. We talk about spironolactone, we talk about their age and sort of the genetic predisposition to it falling out almost no matter what you do. But I do think PRP works. Now, I know everyone's going to say, but it's not proven. There's no double-blind studies. I know, right? But it does matter how it's made, who you go to, and what their results are. Because this is not something you're doing like in the back of a spa, like by some random person. This is definitely like a doctor-owned process. And can I tell you, why some are better than others? Yeah, because it depends how you extract the PRP. It's like a very simple, corollary in terms of the actual platelet factors that induce hair growth and kind of help revive that follicle. And I've seen such amazing results for patients that I feel like it might not make your hair come back to the way it was when you were 30, but it can certainly stop or arrest the loss in a prolonged way. So I do think, yeah, Remo, completely, it depends on whether you're extracting with a calcium chloride or an aluminum chloride. And this is where I think it's an exciting time to be a board certified dermatologist, because we have access to that literature where people have actually evaluated that. Yeah. Not all PRP kits are the same. So if you're getting PRP for in the US for $200 a treatment, you're getting $200 PRP, and that's not going to work.
Yeah. No. It's like this, right? You got an expensive car, you want to put top of the line fuel in it. You don't go and buy a top of the line car and then just put regular gasoline.
Yes, exactly, because the engine won't work. Exactly. But PRP works 100%. And when you see people, I tell patients that they can expect 30% improvement. Yes. But I also think it improves hair density and quality. I don't know if you've noticed that. I mean, I don't think it just makes your hair grow back more. I think the existing hair where you inject it actually is better.
It is. So what we do is we use the trichoscope on the scalp, and we take pictures of the area where we're injecting. So we're able to compare the number of follicles in that area and the density of the follicles. And we've always noticed that when we use the PRP from the kit, which we use, which is like the approved one here in India, the results are remarkable, because not only is the number of hair follicles, but it's also the thickness of the hair, the quality of the strand. And you can also see that if hair is damaged, it's got these micro cracks on it. And that seems to heal when you've got a PRP treatment. And when you actually break it down and you're looking at the growth factors, you've got so many, like upwards of 12 in a good PRP. So you've got you've got those vascular stimulating, and then you have the stromal stimulating. So you're stimulating every single element in that area. So, from the vascularity to the cell turnover of the hair. So I'm sure that we're definitely getting changes in the hair density and the texture.
Like when we inject it into skin, I don't know that it does the same thing as we do as when we inject it to the scalp. I find PRP injecting to the scalp is a home run. Injecting into the skin, kind of like this.
It's a good add-on, but it's not a standalone.
Correct. I was just going to say, but when we do put it on the skin after big laser procedures, the healing time is phenomenal. Like, do ablative lasers, put that PRP coat on afterwards, and they have the healing time is down by half. And so, it doesn't surprise me that you're finding that those, kind of micro cracks in the hair are improved just with PRP. For Remo, we do PRP as maintenance. We offer it once every 6 months, but some people don't even need that.
So we offer it every quarter, actually, because we say every quarter your hair is changing. So just do it every quarter as a maintenance, and it's just easier to maintain your hair like that. Because if you leave it for 6 months, sometimes we've noticed that people, where we've helped them regrow their hair, they'll start seeing the thinning again, and they start going up towards the tail end, and then it starts panicking them again. So we don't want that stress level up. So we're like, once in a quarter is good for maintenance. And quite a lot of people are happy to do that once they see the results, because they got hair, and once in a quarter is nothing, half an hour of their time.
Exactly.
Super. Do you have any pearls of wisdom for our listeners today on hair fall before we end our session?
Well, first of all, it's been a pleasure to talk to you today about it. I always love chatting with you. It's always so much fun. Look, I think that hair fall is a real thing. And, you want to find somebody who believes your story. And number 2, know that there's a lot of options. And number 3, just because you feel like you don't have options, don't start turning to internet wisdom, because it can be like snake oil salesman, right? Because they've got you in a vulnerable position, and you can almost believe and be sold anything because you're so panicked. So go see a doctor, go see a dermatologist. This is what we do. And I think that we can help you on the medical side, the cosmetic side, but we can more importantly get you an answer. So instead of turning to your Masi or Buaz or whoever telling me whatever,
exactly. Exactly. Very true. My mom told me this. My grandma told me that. My neighbor told me this. Yeah.
Yeah. You told me to do this, but when I went home, my friend said, do this. And you're like, didn't we discuss that already? So,
I'm
yeah.
like, was I a fool to spend like all my youth studying in college? I should have just been your neighbor. Sometimes. But yeah, but thank you so much, Kavita. It was a lovely chatting with you. I love your energy as always. I
Thank
mean, with those three boys, I don't know how you keep your energy levels this high all the time, girl, but awesome.
you
Thank you so much.
at 9:30 at night. So I really appreciate it, Chitra.
Oh, for us, it's early.
Oh,
Remember, it's early for us.
oh, right, right.
Right. It's 9:30 in the night is nothing. It's very early. All right. Thanks, Kavita. Stay safe, and we'll hopefully see you soon somewhere sometime.
Absolutely. Bye, Doc.
Bye bye. See ya. So that was my friend and colleague, Kavita Mariwalla from New York, and we've discussed a lot of tips and pearls, and we've learned a lot of new things about your vitamin D levels, where they should be. So you should be on the higher side of the normal. Biotin may not necessarily be the supplement that you need to concentrate on. It could be the other supplements that we're talking about. And of course, stress plays an important role in hair fall. So thank you for joining me this evening on Saturday. And I'll look forward to seeing you all next week for my live session. Till then, stay safe and stay healthy and stay beautiful.